see how you can juxtapose this and see if Nigeria could head in that direction.
Well, interestingly, I was also going to start from there, that has the president spoken to members of the National Assembly with the with the member of National Assembly that said that that was celebrating his 20th child. But that being said, I don't see 2% as being feasible. But in recent time, we know that fertility rate has declined, and it's practically also because of the economics of it. Today, you have a lot of folks in the middle class that it will be very rare to see anyone with 3 children these days. Mostly people go for 2 children, because what you hear is the fear of school fees is the beginning of wisdom. So the question is, can you afford to have that many children as you would think you want to have initially? But yes, the economics cuts across different areas. Yes, it does affect a lot of people across the socio-economic strata, which we then get to see a lot of people in the middle class having to say, okay, maybe they want to have 1 or 2 children because of the level of education, the quality of education they want to give them. And there's also the place where we have certain folks that believe that, you know what, there's a public education system. They can have as many children as they want.
And it's God that takes care of them?
And the government takes care of them. So, yes, it does come back to the economics of it that affects, 1, quality education, 2, the amount of health care you can give them. Because, I mean, we know that different people born in different ways have different health challenges. And we always pray against all of these things, but it is life and it does happen. They are actual realities. For example, you live in maybe a 1-bedroom apartment, or maybe a room and parlor, and then you have maybe like 6, 7 children, and then 1 child has smallpox. What do you do? So these are conversations that need to be had, and they need to be had.
Right.
They need to be had in full with a lot of folks in terms of sensitization to why it may be prudent to see how we can not have as many children as possible. Because when you have this conversation, certain people will say, oh, it's my tradition, my father had 6 children, I should have 9. And the whole conversation around the tradition really should be looked at a foundational level, because it wasn't just about having children. Either you like it or not, children were actually born en masse back then because they were cheap labor, they were free labor. So, I mean, if I have 9 children in my household and then you have 3, there was a cost-benefit analysis to it, saying that in my household, we could perform 3 times better than you on our farmlands. We would have 3 times the output, 3 times the outcome on our farmlands, as opposed to you that have 3 children. Now, mind you, me having 9 children could also mean that I also have maybe 2 or 3 women that gave birth to those 9 children for me. So you also have adults that also contribute to that workforce. So that is why a lot of people had a lot of children
at the time.
At the time, but right now it isn't fashionable, and it isn't just of any long-term economic benefits to us as individuals, as families, and to the society at large.
But I've met people who say that they look forward to having a large family.
Yes.
Educated.
Yes.
And they are not interested in the fashion or whatever the challenge. They believe that they will survive the challenge, economic challenges. They have relatives who can also be of help and all of that. So, yeah, there's that. But then it's a critical issue, talking about education, educating people, tradition, how they come to play, what the situation is. Now, it is often said that when a woman is educated, empowered when it comes to education, certain decisions she can make. But as it is, when you look at girl-child education, it's something that is nothing to write home about. How do we address this? Because, like he rightly pointed, these are foundational issues that have to be addressed.
Like you mentioned, there are different perspectives to this, like the reasons why people want to give birth. But what we must also look at in the data is how the fertility rate across Nigeria, across the southern and northern region, and how urban communities, peri-urban communities, high-brow area, what's the fertility rate across these places. And there are also statistics that say that when a woman is educated, there are high chances that she will delay sexual debut.
Yes.
Right now, we have very early sexual debut in Nigeria for a lot of reasons. Child marriage, exposure, so many other things that is causing that. But we have to look at also the underlying factors. access to education, access to economic opportunities, tradition, religion, and so many things. Access to healthcare. Many women today in Nigeria want to have access to contraceptives, but they don't. Why? Because their husband doesn't want them to, or because of the fear that their husband is going to get a second wife if they don't give him that third child, fourth child. You know, so we have to look at all of that in terms of even national orientation. How
well have we performed even in that aspect?
Well, I would say that the contraceptive prevalence rate in Nigeria is increasing, especially if you look at urban communities and peri-urban communities. But if you still look at highly uneducated urban communities, you see that there's a very low prevalence of contraceptive use, especially modern contraceptive use. Some people still use the traditional contraceptive method, which is necessarily not as effective as the modern contraceptives. And there are so many things to it, so many ways to think about it. If you think about it in terms of women's health and maternal and child mortality, then you see that there are huge consequences, even for women that give birth a lot. So there are high chances to reduce maternal mortality when you reduce the number of births from a woman. So there's so many benefits to this.
Right. Perhaps you have to reel out the benefits and the disadvantages with regards to have women who give birth a lot, like you mentioned, and the use of contraceptives, because this is a way of educating people who are also watching. So go ahead.
Absolutely. So I would say, first of all, what you need to think about, like Deepo said earlier, was that you have to think about the economic benefit of even give birth to like 1 or 2 children. You think about women who give birth to 5, 6, 7 children, and you think about the fact that in the number of years that this will claim in their lives, for example, they have reduced ability to be able to contribute to the workforce. You know, they have to take longer days off. They have to take care of their children, pregnancy and everything. And also look at it this way. If a girl gets pregnant while she's in school, the guy doesn't get out of school. It's the girl that leaves school. Even when the school say you can be pregnant and be on campus, there'll be a point in time when the girl has to still leave school because of the reality of her health. So that's the situation. That's what it can mean for many women and girls. And if you also look at it in the terms of consequence of maternal and child mortality, you see that there are high chances of maternal mortality when a woman gives birth to more children compared to when she gives birth to 1 or 2 children, because many times the doctor is advising that you can do 1, but if you do more than this, then there are huge consequences for this. And if you also look at it in the aspect of life outcomes and the economic burden of so many children, you realize that the burden is not even on the husband and the child. It's on the extended family, it's on the community, it's on the country. For every child that you cannot take care of, it is a threat to not just your family, but to the community as a whole. So if you look at it holistically, you even realize that when you think of religious benefit or traditional benefit, and the consequence, you know, if you compare it, you see that it's not worth it to go that route. And if there is economic prosperity, it benefits everyone. Absolutely. A sad family cannot lead to a productive nation. It's difficult.
Really difficult. But Deepo, let's get back to Nigeria now. Coming up with this policy, are we prepared to actually see it through? Because when you look at discussions across the board after this announcement was made, there are talks by experts saying that Nigeria has to invest critically, make investment in the health sector and to address this issue holistically. But as it stands, are we prepared?
I'm not sure we're quite there yet, even though I believe that there are places where we could start. So in terms of execution, because that was the first thing that came to my mind when I heard of it, that it wasn't just going to be about lip service or false PR. In terms of execution, now, this is how I see that we can approach it. Starting from awareness, because that's where it first starts from. Awareness, communicating to people about family planning, contraceptives, and all of that. Now, you'll agree with me that, at least in Lagos, that there are a lot of local governments that have, I think they have a health department, those folks you see carrying around boxes that give immunizations about, those are laid down structures that exist that can be maximized and tapped into to see that awareness is being done properly. Now, the question is, are you engaging them? Is that the plan? Are you going to provide funding? Are you going to provide materials? Are you going to provide contraceptives for them? In terms of counseling, how do they go about it? Do they have town hall meetings? Maybe do they collapse maybe like 3 streets together with advance notice so that they can have a conversation with not just the women but also their husbands, because you also need to understand that in the household where the husband says no to contraception and you go talk to the wife, it's as good as not having a conversation at all in the first place.
Right.
So we need to understand that we need to have the conversation as a family unit. Also understand the peculiarities of a society where mostly the folks you'll be having these conversations with may have to leave the home as early as maybe 5 a.m., 6 a.m. So by the time, even on weekends, because there are people that have to make a daily living so that they can fend for their families. So the question is, how do you reach out to those people? Do you go to their places of business or do you go to where they live? Do you go on a Saturday? Do you go on a Sunday? So there are a lot of logistics to go about it. But I believe that yes, it is possible, it can be done using existing structures. But in terms of the overall investment in the healthcare, we haven't seen as much as we ought to have seen. The other day we talked about what happened to the COVID funding that we got, how we haven't seen any existing hospital or healthcare facility being upgraded to international standard, let alone having new ones built. So we're not seeing a lot of deliberate action being done in terms of the entire healthcare sector as a sector in itself. So not just talking about having contraception or family planning, which is an element of the healthcare sector in itself. So yes, if we're saying that we need to look at a microcosm of a particular sector, we also need to pay attention to the sector at large, because that's the only way we can be sure that you're serious about what you're talking about and not just paying lip service or trying to go with current trends with the UN or any other part of the world.
Absolutely. Now, let's look at critical issues here with regards to the role of perhaps religion and every other person, community communicators and all of that. Recently, there was a video that seemingly went viral of a girl who the police arrested because she went to buy contraceptives. We still see that, you know, access to these things, you know, people seeing you with this thing is more like a taboo. Now, how do we address that, having a mindset shift for a lot of people across the board? Because we still see some of these things as things you shouldn't even talk about at all.
Well, I would say that what happened to that girl is a typical example of trampling on a human right. Access to contraceptive is access to human right. And that's what it is. And every girl, every woman should have full access to their body to do whatever they want to do with it. It's also important to invest in sexual and reproductive health and right of women and girls, because it can lead to huge economic outcomes if we do that. However, looking at the different areas we can invest in, or how to think about religion or culture, we have to think about it holistically in terms of health promotion and behavior change. Behavior change takes a long time in terms of working towards this things. Sometimes we've worked on behavior change programs that took up to 5 years.
Really?
And yeah, that's even small. Even look at the campaign of Gold Circle Condom in 1992, 1993, 1994. You see how long it took for people to even accept. So many young people still go into pharmacies today to ask for condom, and then they ask for paracetamol, for different things before they get. So it takes a lot to get there. And you also see that a lot of health promotion programs now are now encouraging religious leaders to be involved in the process, because we cannot ignore the role of a religious or a traditional leader.
Absolutely.
It's important. In some of our program, we would even have easy access to the Ministry of Health and Ministry of Education, but then there won't be change until you probably speak to one traditional or religious leader because people listen to these people. And like Deepa was saying, solutions are relevant when they are contextual. You know, we have to work with what's relevant to us, what's contextual to our setting. In this setting, religious leaders, traditional rulers, they have huge power of influence, especially of people, quote and unquote, that we might say of low income status. So we have to consider that in our health promotion. This thing. We also have to consider the role that social media or online platforms currently play in changing behaviors or influencing behaviors today, and how do we effectively use that? If you talk about contraception for young people, I don't like to call it even contraceptive for young people. I like to call it life planning, not family planning, because a lot of people would say, I don't have a family yet, so why should I use contraceptives, or why should I be doing family planning? But it's about planning your life. That's what it is, either you are married or not married. And if you look at the amount of conversation happening online today, and if you take contraceptive message or health promotion message to health program, you ask 1 in 10, every 10 young person that, how often do you watch a health program? None of them would say. But how often do you watch sport, entertainment, and every of those programs? It doesn't mean they're unserious for watching those things, but why don't you find a way to integrate this messaging into what young people see? Right. So it's also evolving the way that we do some of this health promotion message. Before now, what you see is that we probably have 1 or 2 TV stations when people come over at 4 o'clock and TV comes on. But the world has evolved. Absolutely. And the platforms that young people can see things or view things, it's evolving. A lot of people say, young people don't like to read. I like to say, the platforms where they want to read has evolved. So put those things there. They will see it. Put it in the way they should see it. They would see it. So those are some of the things we need to consider, and also make sure that influencers have a lot of power. And influencers could be online, offline. They could be that religious leader, they could be that traditional ruler. How do we effectively bring all of these people together in a room to have a dialogue for mutual understanding, to show that we are not trying to change what you believe or what you think should be. What we are trying to do is to make sure that this current population live to their full potential.
Right. Now, the aspect of government taking responsibility going ahead, because it must lead, is where I am headed now with you, Dipo. The various levels of government, how should they drive this policy to ensure that it achieves its goal?
Well, we have the Federal Ministry of Health, and we have state ministries of health. Question is, how are they being positioned with regards to this policy and in terms of execution? Because now the president has spoken, and the question is there any movement whatsoever within their walls?
Right.
So that is where we need to start the conversation from, because until then, I don't see people being alive to their responsibilities. Because you can't have somebody in finance having to champion the issue of family planning and contraception. There is a ministry where these conversations are domiciled. So the question is, are they doing anything about it? Are they on the drawing board? Are they around the drawing board, having to see how they can strategize, see how they can talk about logistics? He's talked about various factors, fantastic points that that need to be addressed, that affects these issues. Are they considering all of this and bringing out holistic plans to see how they can execute what the president has said effectively and efficiently? So those are the things that we're hoping to see in the next couple of days. But up until then, I think that we just need to keep our fingers crossed. And also, he talked about offline influencers, and we need to understand that every one of us are influencers in conversations like this, because every single day we engage one person, we engage domestic staff, we engage somebody that we take a cab with, we engage somebody that we take a bus with, we engage staff, we engage our colleagues, we engage employers. Can we have these conversations? Because we shouldn't just leave it to the government alone to have the conversations. We shouldn't leave it to the private sector where they have their own profit interests in conversations like this. But we should also understand that it affects everyone. Taking a cue from what he said about having an untrained child, and you also alluded to that point earlier, saying that a lot of people will have a lot of children, having the confidence that extended family would raise them. So let me ask you a question. I have taken the due diligence to plan my life very well and have 2 children. I choose to have 8. And then you're trying to pawn 2 off onto me. Do you think I would accept that? Because now you're going to disrupt my financing. You're going to disrupt my plan for my own 2 children and my immediate family, which is something that has been happening for decades.
Right.
In this part of the
The
world.
communal life that we
So we need to understand that there are consequences to it. So the family member you don't talk to today will end up pawning their child off onto you in the next couple of years. So we need to have these conversations.
Everyone should take responsibility.
Everyone should take responsibility. It's not just the government. Everyone
Right.
is responsible, because as a society, we need to have these conversations,
All right.
and the implications are holistic for us.
All right, we have to leave the conversation here now, gentlemen. Strategy consultant Dipo